Influenza. So I'd like to discuss flu with you today, and the topics that I'd like to cover include vaccination, who should be vaccinated, what groups of people are most vulnerable and would benefit most for vaccination, what are the typical signs and symptoms of flu, how do we diagnose flu, and what are the treatments that are available if you do develop or contract the flu virus. So as far as vaccination goes, we basically recommend that anyone 6 months of age be vaccinated. We think it's a safe and effective way of reducing complications from flu. So vaccination is definitely recommended for anyone aged 6 months of age and older who doesn't have any contraindication or allergies to the flu vaccine. We recommend people be vaccinated early. So usually the flu vaccine is available August or September of each year. And we say, go ahead and get vaccinated as early as possible as soon as the vaccine is available. It usually takes about 2 or 3 weeks for antibodies to develop within your system. And so for the vaccine to be effective and you to be able to appropriately fight off the flu, it takes 2 to 3 weeks after vaccination. So who needs to be vaccinated? Well, definitely people 65 years of old or of age or older, elderly patients obviously need to be vaccinated. People who are at high risk for complications for pneumonia. So what are some of these complications? Well, you can develop complications from influenza that include pneumonia, any kind of worsening or any kind of associated upper respiratory tract infection. Some people develop respiratory failure and require hospitalization. So there's definitely a lot of complications associated with influenza, and people who are at high risk for these complications should be vaccinated. People with asthma, with any type of lung disease, diabetes, any kind of pregnant women, people with many medical problems that predispose them to chronic illness. So these are the people that benefit most from the vaccine, but definitely anyone 6 months of age or older will benefit. So what are some of the typical signs and symptoms that you may have with flu? If you suspect flu, you would typically have fever, possibly a low-grade fever, sometimes spiking fever. Generalized body aches or muscle aches are common. Headache, generalized malaise, fatigue. You would also see a lot of the upper respiratory tract infection symptoms, including the sore throat, the runny nose. So all of the symptoms that you would typically have with upper respiratory tract infection are common, but we tend to usually see fever and body aches that are more pronounced. We do want to be able to distinguish it between flu or influenza virus and another type of virus, a common cold. We would want to be able to distinguish it from bacterial infections like pneumonia or bronchitis or, parainfluenza or rhinovirus, other type of infections that are out there that can mimic flu. So it's important that if you have any of these signs and symptoms that you do seek medical care, that you go and talk to your primary care physician and say, look, I think I may have the flu. So how does your primary care physician determine if you have the flu? Many tests are available in the outpatient setting, so you go to your doctor's office and they'll be able initially to do what's called a rapid flu screen. It's basically a test where they use a nasopharyngeal swab, gather some fluids from your nasal passages. This is a test that is done in-house and takes 10 to 15 minutes, and is a pretty good test. I mean, there are some issues with it. There's some you can have false negatives where in fact you do have the flu, but we do this rapid screen and it's negative, saying the test shows that this person does not have the flu, but in fact they could have the flu. So how will your primary care doctor usually address that? If the suspicion is high, they will usually go ahead and place you on an antiviral, and I'll talk about the antivirals shortly. And then, so go ahead and start treating you for the flu, and then send out additional tests such as cultures or a PCR, polymerase chain reaction, difficult acronym, PCR, that basically gives a confirmatory test, gives a test that is able to say, hey, the rapid screen may have been negative, but the preliminary chain reaction shows that, in fact, this is flu. So let's talk a little bit about treatment. Your primary care physician has confirmed or has a high suspicion for flu. He wants to start treating, and as I've mentioned before, antibiotics do not work for viruses. They do not work for the flu. And most people would say, hey, well, it's a viral illness. Go ahead and let it play its course, and it'll just get better on its own. Not necessarily the case with influenza. We actually have antivirals that don't necessarily cure the flu, but will decrease the duration of the flu and may decrease the severity of the flu. So definitely in patients, as I mentioned before, that are at high risk for complications of influenza, you want to go ahead and treat them with Tamiflu, which is one of the antivirals that we typically use for flu. A couple of caveats on the antivirals. You need to initiate treatment early. So if you suspect you have flu, go see your primary care physician sooner than later. Why? Because he can go ahead and start an antiviral. They need to be started usually between 1 to 2 days after initial symptoms. You're treated for about 5 days. You take Tamiflu, 75 milligrams twice a day for a total of 5 days, and that's the treatment. It won't cure it, but it will decrease the severity and decrease the duration of the flu. As far as if you do have the flu, you're contagious usually for 5 to 7 days after your initial symptoms. So definitely respiratory and droplet precautions, because this is how it's usually spread. Make sure if you have a family member who has the flu, is actively coughing, have them possibly wear a mask. Make sure you're keeping separation of at least 6 feet apart from them. A lot of hand washing. If you're around family members or you're in close contact with someone who has diagnosed flu, talk to your primary care physician, because they will likely place you on a prophylactic regimen of Tamiflu to prevent you from getting the flu. So they'll start you on the antiviral medication Tamiflu. The dosing is a little bit different. You take 75 milligrams once a day for 10 days instead. With all these medications, there are some side effects with Tamiflu. Dizziness is one of them. Some people develop nausea. Talk to your primary care physician about the possible side effects of these medications, but overall, they're safe medicines that can definitely help you get through the flu and flu season.